My name is Dr. Irene Njeri. I work as a physician and I am trained in internal medicine. I work in a hospital called Kiambu County Referral Hospital. This hospital is a semi-rural hospital that is located around 30 to 40 minutes from the Kenyan capital of Nairobi. I recently completed an online course in diabetes, that is a postgraduate diploma in diabetes, and this I did at the University of South Wales, and it was under the Merck Foundation Diabetes Blueprint program. The prevalence of diabetes in Kenya is around 3.3%, and this is intended to rise to around 4.5% in the year 2025. Unfortunately, despite this high prevalence of diabetes, we still don't have enough diabetologists to see all these patients. For example, in my region, there was no trained diabetologist until I did the program, as most of them are located in the Kenyan capital of Nairobi, and we used to have to refer these patients to them. I was very excited to be selected as a beneficiary of the postgraduate diploma in diabetes. Since I was in undergraduate, I have always been interested in the field of diabetes. And when I started working, I worked in a region and still work in a region where there are so many patients with diabetes, but really I did not have any know-how to take care of these patients. So it was very exciting for me and actually a dream come true. The Merck Foundation Diabetes Blueprint program has benefited me in many ways. One, I have been able to increase my knowledge of diabetes. I have also been able to gain confidence to take care of patients with diabetes, including the very complicated cases of diabetes. It has also enabled me to educate my patients appropriately on how to prevent diabetes and how to prevent complications of diabetes. It has also made me gain enough knowledge because I teach students, so I am able to impart the right knowledge to the students who come to learn within our teaching institution. The knowledge I have gained from this program has enabled me to benefit the community around me. This is because I have been able to reach out to the community and teach them on preventive practices as regards type 2 diabetes. I have also been able to teach patients on how to manage type 2 diabetes with largely a focus on lifestyle changes. One of the biggest advantages or benefits that I got from this program is that we were able, as a group of students, to publish a paper in an international journal, and for me it has been my first publication ever, so that was very exciting and a highlight for me. Yes, I would recommend the Merck Foundation Diabetes Blueprint program to other practitioners. One, because of the knowledge that is gained while doing the course and the beneficial impact it has on the community as well as an individual. One of the biggest benefits from the knowledge gained under the Merck Foundation Diabetes Blueprint program was taking care of a patient who was training to be a police officer and was diagnosed with type 1 diabetes. Unfortunately, this patient was on a formulation that was not enabling her to continue with the training. But once I applied my knowledge and we changed the insulin formulation, this patient was able to go back into police training and is now in active police service. Having recently completed the online postgraduate diploma in diabetes at the University of South Wales under the Merck Foundation Diabetes Blueprint program, I was recently invited by the Ministry of Health to review the national diabetes guidelines and also to put input into the essential drug list for diabetic medication. My career has really grown since I completed the online postgraduate diploma in diabetes. I find that now my colleagues in other departments reach out to me whenever they have any cases of diabetes, especially those ones which are more difficult to treat. The other thing also that I've been able to do is to diagnose complications early in patients and start them on appropriate treatment to prevent these complications from worsening. I want to thank the Merck Foundation for sponsoring me in this postgraduate diploma in diabetes. And I think this program should continue because the cases of diabetes are rising, and by 2025 we probably will have doubled our cases of diabetes. So this program will be very beneficial to our patients and the community at large and also the country. Thank you.